Yeah, my name is Hoyen. I'm a consultant psychiatrist and editor of Global Psychiatry Archives. I'd like to tell you the ins and outs of a paper published a while ago, and it's about the association of executive function, craving, and precipitants of relapse and alcohol use disorder, and a cross-sectional study. It's 46 patients from a tertiary hospital in northern India, and these patients were assessed using cross-sectionally with the obsessive compulsive drinking scale, executive functions using the risk constant card sorting test, and also about a relapse scale. So the study focuses on the alcohol abuse disorder and was cross-sectional. Patients were attending a de-addiction clinic and adult outpatient department in northern India. They were all assessed and diagnosed with alcohol abuse disorder as per DSM-5. The sample, and this is coming to the table, is quite a mixed sample. The average age is about 26 or whatever, 35. So the postgraduate, lots of postgraduates, students, some students, semi-skilled workers, most of them, and the income in Indian rupees were mostly up to 10,000. Lots of them were married, or most of them were married, and some lived in rural areas, some in urban areas, and have different family structure. So this is next table 2, come to some of the results. So there is a significant correlation between the relapse precipitant inventory and this obsessive compulsive drinking scale. And the most important part is a correlation of quite a few domains with the relapse prevention inventory. So people who had who had a negative mood state, most of that, and some of them less in cognitive vigilance, were more likely to perform bad or worse in some areas of the Wisconsin card sorting test. Some were trends, but some were also significant. So the trials completed and the categories completed were related, or they're less categories completed and more less trials completed in the first category were related to these relapse and precipitant inventory domains. Right, okay, so then we see here the Wisconsin card sorting test domains in people with obsessive compulsive drinking scale, and you can see that there's some of these categories or some of these subscales of the Wisconsin card sorting test showed a little bit of a trend towards significant, but there were also some which were significant. So people who had more or less more obsessions and compulsions were more likely to have mistakes in the Wisconsin card sorting test. And the outcome of the study is more or less that there was a significant association between craving and poor executive function, as well as relapse and cognitive dysfunction. However, some of these tests weren't really significant, which might be related to the fact that the sample was quite low, and this needs more or further discussions and investigations. So in total, people with relapse predictors or precipitants and more craving or different types of craving had a poorer performance in some areas of this Wisconsin card sorting test, which is a measure of executive dysfunctions. So what does it mean that cognition is associated with relapse and alcohol craving? This is more or less a summary, and I'd like to invite you to like this video, as well as to subscribe to our channel, which will produce and present further studies. Please subscribe to the channel Global Psychiatry Archives at YouTube. And if you want to read the paper, which I invite you, there would be the opportunity to see this paper on our Global Psychiatry Archives website, www.globalpsychiatry.co.uk. Thanks for your interest, and I wish you a nice evening, and hope you can enjoy this and more of our papers, which we present here in short excerpts. Thanks a lot.